And today my guest is Ben Thompson from Treble Health, based out of the Bay Area in California. Thanks for being with us today, Ben. And we really appreciate your time, energy, and effort that's going to go into the session today.
Thanks, Bob. I'm so glad to be here and share what I know.
Well, before we get too far into this a little bit, can you tell us a little bit about your journey into audiology and into the treatment of tinnitus patients?
Absolutely. So I am one of two brothers who are audiologists. My older brother Garrett and I are both audiologists. Our mom is a speech therapist, so we definitely have a family in the hearing and speech world. And my particular interest was working with tinnitus patients because I found a connection to really helping people who are suffering a more holistic, comprehensive view on not just their ears or not just hearing aids, but helping things like reducing stress or changing someone's anxiety related to the tinnitus sound. I had some great mentorship in San Francisco and completed my studies under Troy Cascia, who is at UCSF Medical Center in the tinnitus treatment program there. And he comes from the lineage of working under Dr. Robert Sweeto. So yeah, I just had a great education, and I was shown, hey, tinnitus and hyperacusis treatment, this is possible. This works. I saw the patients getting better. And in addition to that, I had a patient drive 4 hours from Lake Tahoe, California, all the way to San Francisco for an appointment with me. And she confirmed that, hey, she already went on to her audiologist, to a local ENT doctor, but was not provided a clear treatment path. So that was my aha moment that, wow, if I have this specialty skill that is clearly it's helping people in an underserved market, they're willing to drive 4 hours to see me for an appointment. Well, Bob, that appointment could have happened over Zoom. This was pre-pandemic, this was pre-COVID, but I knew the technology was there. So some light bulbs went off, and eventually I started a YouTube channel and eventually started a telehealth practice, all specializing in tinnitus. So yeah, I've been running Treble Health, the practice, for the last 5 years, and we see a high volume of patients. Our YouTube channel has 150,000 subscribers, and we've seen over 2,000 patients through a comprehensive treatment over the last 3 years, with a very good success rate consistent with tinnitus retraining therapy. So that's a little bit about me, and I really love to help anyone listening, whether it's sharpening their tinnitus skills or potentially offering a more robust treatment in their clinic.
Hey, tinnitus community, it's Dr. Ben with Treble Health. I have some big news. We opened 2 physical locations, California and Florida. Specifically, San Francisco, California, the Bay Area, and just outside of Fort Lauderdale, Florida, in a town called Weston. That's accessible from Miami, Fort Lauderdale, Boca Raton, West Palm Beach, and Naples. So if you are in these areas and you know someone who has tinnitus and needs help for that, absolutely check out the links below where you can schedule a free consultation at these clinics. This is a big move for us, and it's all possible because our YouTube community has spread this message that there is treatment, there is hope for people with tinnitus. I love what I'm doing, and thank you so much for the support. Please check the link below if you know anyone who could benefit from speaking to a doctor at a Treble Health tinnitus clinic today. Now back to the video.
Wow. Well, it sounds like the kinds of things that you discovered have been going on for a long time with tinnitus. Starting to treat tinnitus patients in about 78, when it first even we knew we could do anything at all. The kinds of things you just described have been happening over and over and over again. And so now, how can you deliver tinnitus treatment over a telehealth situation?
Yeah, there's 2 modalities. One is counseling, and people might not realize counseling is a big part of helping patients get better. It's the advice we're giving, it's the support we're giving, it's certain counseling strategies. All of those actually help reduce the tinnitus sound and the impact over time. So it's not just consoling someone, it's really providing a specific counseling service. And then also the medical devices. That could be from, I have some in front of me right now. That could be all the way up to, some hearing aids right here that can be programmed either for hearing loss and tinnitus or just for tinnitus with normal hearing. We can also use sound machines, just like this one as well. So, though the combination of the counseling plus the medical devices, that's what the patients need. And with telehealth, counseling is easy. It's a Zoom call. That part of it is very simple. Most patients are used to it now, post-pandemic. The medical devices, that's where it can get, or even just the regular sound therapy devices, that's where it's a little nuanced. So yeah, we do work in the remote care model. We have permission from various manufacturers to fit the devices and follow up the patients remotely. And we do require an in-person recent hearing test. And we do require that the audiologist is licensed in the same state as the patient. So that's how that all works. And the technology is really outstanding. It's worked very well for us and our audiologists and our patients.
Do you have some specific kind of communication strategies that you use with the to create the hope and some of the counseling things? I know for years we Jay Hall and I did a course in counseling, and about 1/3 of it was all on tinnitus and how to go about some of the treatments. But that's been a number of years ago, and I'm sure that there are a whole lot of other kinds of things that you're using to facilitate some of these discussions.
Yeah, I'm so glad you asked. One of the audiologists on our team, head of our clinical audiology team, Dr. Suzanne May, she recently posted on LinkedIn, and I have it up here. I'm going to read it because it's so relevant. It's what the doctor says and then what the patient hears. So when an audiologist or an ENT doctor would say there is no cure for tinnitus, the patient actually hears there is no hope. When a doctor says, there's nothing you can do for tinnitus, what the patient hears or feels is, I'm going to have to live with this the rest of my life, and it's not going to get better. When we say, hey, just ignore it, just try to not think about it, the patient might feel or think in their head, ignore it. There's no way you can understand what I'm going through. You're lacking empathy and even understanding of how this is affecting me. Or additionally, hey, tinnitus isn't that big of a deal. I have it. The patient might feel, my provider doesn't know what I'm going through. They don't care. I think it's so important. And it really touches on what's going on here is that we want to help people, but if we're saying the wrong things for this sensitive of a condition, it can actually do more damage than help someone.
Well, empathy is huge in tinnitus. And especially when you're seeing a number of tinnitus patients, most of us have heard the horror stories and of not just the tinnitus itself, but also some of the treatment horror stories that have been going on. And probably the biggest one is there's nothing I can do for your tinnitus from ENT physicians. Not all of them. There are many of those guys that are enlightened and so on, but it still happens routinely. Now, how much do you go into the causes? Because the causes are still kind of up in the air, with tinnitus, as we know. How much do you go into the causes and the treatments and the options to these telehealth patients that you're working with?
Yeah, explaining the causes of tinnitus is very important. And there's a simple framework that I've adopted, that I've learned over the years. There's 3 main subtypes or root causes of tinnitus: cochlear, which we all know it's related to hearing loss; central, which is sort of stress induced or related to the central nervous system; and then somatosensory, which is related to the neck or the jaw most commonly. So that can just that simple knowledge of, can I help diagnose or identify where is this tinnitus likely coming from and explain that to the patient, right? That's so much different than the patient says, hey, what's causing this? And you say, it's your hearing loss. Sometimes it's a lot more than hearing loss. So that really connects with the patient. They feel like you understand. So that's important. Similarly, identifying the right treatment for them. It's not a one-size-fits-all treatment for tinnitus. So that means understanding Is it a combination of counseling and a device? Is it just a device? Which device is it? And also the provider should understand, okay, what do I feel comfortable doing? And then when should I refer out to another specialist who does work with more moderate to severe cases of tinnitus?
Now we talked a little about how you're interacting with your patients, Ben, but now how do you grow the tinnitus side of an audiology practice for those who maybe have been a little bit hesitant to do that in the past? All of us would hope that audiology clinics would be a place where kind of a haven where people would go for tinnitus treatment. So how would someone who's not doing that expand into that side of their practice?
Yeah, I'd love to ask you a question as well, Bob, which is, the typical best practices to grow a hearing loss treatment business are probably similar to the typical best practices to grow a tinnitus business or a tinnitus part of the business. It's a combination of marketing, sales, brand, professionalism. Where I see the gap is that most clinics don't have a practiced patient flow or a well-designed patient journey for tinnitus. What do you see out there in terms of clinics, of how many clinics are really set up to help someone with tinnitus, whether it be their website, the actual consultation, how they communicate it, the training the provider has? Like, I'm curious what you're seeing.
Well, of course, my orientation's a little bit less than it was a few years ago, but my impression is there's not more than 20% of the audiology clinics that are actually providing tinnitus treatment. And they might, if they advertise, many of them advertise tinnitus. In fact, a lot of them advertise that they treat tinnitus, but it's all hearing aids. It's all they're working with the 65% or so that can be treated with amplification to reduce the tinnitus or to sleep better at night or something like that. The ones that are actually doing the treatment of the tinnitus, it's a much smaller group of individuals because they're actually using some of the sophisticated devices, some of the sophisticated knowledge, some of the sound therapies, and some of those kinds of things to go along with counseling. When we used to do the courses, the counseling courses, we felt that about 80% of the tinnitus could be handled really well with counseling, and as well as possibly some amplification. However, there's that other group that's a real special group that is difficult, and you really need some extra expertise. You need to be able to, you have to, at least from where I sit, you'd have to modify the practice some flow a little bit, as you have mentioned, to keep the financial credibility of your practice going also. And so I think it's a combination of wanting to work with tinnitus patients plus a financial stability for your practice, in addition to the knowledge and expertise that keeps changing at least once a week, whether we need it to change or not, and go with, what was it? Carhart said that researchers in tinnitus would fly into this, that researchers have the capability to sit back and kind of wait and see what happens and then make some recommendations about what to do. But those of us that are clinicians are sitting in the clinic, we have a patient in front of us asking us for help with something and what it's going to do. And he basically said, 1975, by the way, that the clinician has the greater responsibility because we have to stay up on what's going on all the time and actually apply that to the patients that are sitting in front of us each day. And so I think there are some individuals who don't really care about treating tinnitus. There are people who would probably like to do that, but want to get more skills, and they don't necessarily feel like they know enough about it to facilitate it. So at least that's kind of where I would see those things at that point.
Yeah, I think that feeling competent in your skill set is important. if you're going to offer a tinnitus treatment package for a patient, the provider needs to be confident in their skills. So I know myself, others, there are certain training programs that are helping audiologists learn more skills in tinnitus. So I'd like to see more of that. I'd like to collaborate and make that possible, because education for the provider is going to help a lot of patients. Yes, and in terms of that business angle, what I've experimented different methods over time, but I've found that the combination of very good counseling plus devices, if they're a device candidate, strong recommendation for that, and then having the patient agree and sign on to start the program, and then commit to it, because tinnitus is a very slow moving treatment. It takes more time to see results than hearing loss treatment, for example. So we need the patient to be bought in and to actually do a lot of work in terms of different techniques, different exercises, whether that be fundamentals of CBT or stress management, as well as compliance using sound therapy or hearing aids.
Well, it sounds like you're well on your way to having an orientation. So the advice you have for practitioners that are looking to add tinnitus to their practice, what kind of advice do you offer colleagues that may be wanting to add this into the clinic as something that they offer their patients routinely?
Absolutely. I would say first, self-awareness of what is your existing skill set with tinnitus patients. Do you need more training? If you do, start small and go to a workshop or do a course for tinnitus for audiologists. That's really important. From there, create a treatment package, which is not just hearing aids, and you say, hey, tinnitus patient, you need hearing aids. They go, whoa, I'm not here for hearing loss. I'm here for tinnitus. So just be mindful of the language you use. Hey, I have a treatment for your tinnitus. It includes these sessions with me. It includes hearing aids. It includes XYZ. That is a much, that's what the patients need to hear. And that's what's going to get them to actually get better, because they'll work with you to do so. I think that's like the first main things to get down.
And then from there, you just kind of build upon that. Now, my understanding is that the kind of methods that you're using here with Treble Health, you're beginning to kind of expand that a little bit to into other parts of the country even. And can you tell us a little about what's going on with that? Because it sounds like there's been some good success here, and all of us that feel for our tinnitus patients all day, every day, would love to see clinics expanding into the tinnitus area for treatment routinely around the country.
Yeah, I have exciting news. I have exciting news to share that Treble Health, which has been telehealth for the last 4 years, is opening brick-and-mortar locations in the second half of 2025. And the reason we're doing so is because we know that many patients prefer to be seen in person.
Yep.
We have had a lot of patients come to us, and we've done a great job with the telehealth model. We are planning to continue with that and grow that, but also to have a brick-and-mortar physical clinic experience for patients who prefer that. And we're really excited about what's to come. We know that there are so many patients who do not get great tinnitus treatment. It's a combination of the counseling and the device. And when they both are set up properly with a provider who's really well versed in the nuances of tinnitus, then that leads to the best outcomes. So we're really excited to bring that to the physical clinic space soon.
Well, it's been great discussing this with you here, Ben, and I hope that as you continue to do your videos and as you continue to develop your practice with focusing on tinnitus, that people will consult Dr. Ben Thompson for advice, and maybe even you'll end up doing some courses for people because of the experience and things that have been successful for your particular practice.
I'm very open to that, and I think it's a great idea. I would encourage anyone who wants to get in touch or just say hello to find me on LinkedIn, Ben Thompson AUD. And yeah, feel free to reach out. I'd love to hear from the listeners here. And Bob, always a pleasure to hang out with you too.
Great. Very nice to meet you and interact with you for the first time here, Ben. And thanks so much for being with us today. And to all of you out there, thanks so much for being with us again here at This Week in Hearing. And be with us another time when we bring another innovative practitioner to the forefront so we can all consider the kinds of success they've had in their practice and maybe integrate it into our own practices. Thanks again, Ben, and we'll hope to see you another day, another time.
Thank you so much.